The key risk to the patients when the handover system is prolonged or delayed is the fact that the patient can still deteriorate whilst on the hospital trolley. There's obviously the risk of misdiagnosis, and all the while patients are in the hospital environment within a delayed handover process. It means that our crews are still with them. They're not out on the street dealing with the people in the communities that we're trying to get to. So the benefit of a timely flow through the department and the handover process is obviously it's a seamless flow for the patient. It's timely for our crews, and ultimately that means that if our crews can hand over in a timely fashion, they can get back out, restock, and then get back into the communities where the other patients are waiting for them. Primarily the key areas to focus on are the 15-minute handover time, the fact that crews, when they're bringing patients in, should be handed over to a senior clinician where possible, and it enables patients then to be early identified which are fit to sit and not block up trolleys and beds. For me, everybody's involved. It's one real big team effort. It starts before the call, it continues during the call, and then it continues on further after the call.
The key areas to focus on with regards to ambulance turnaround times are ensuring that you've got adequate space in the emergency department, ensuring that you are aware of what patients are coming in to the department via ambulance, so keeping an eye on your ambulance turnaround screens, and also making sure that you've got the correct flow out of the department by ensuring that you've got adequate beds in the system to discharge patients from ED to inpatient areas. Okay, so the tools and practices to support effective ambulance turnaround times in the department are ensuring that we have an awareness of who's coming into the department, making sure that we use space safely. So there are times when we need to nurse patients not in bays or in cubicles, making sure we use the fit to sit model to make sure that patients who are able to sit out in a chair do so to free up trolley space and trolleys in the department. We're also making sure that we follow the trust escalation policy as well, and that should be used in times of great need, not just routinely. Prompt handover has a huge impact on patient safety and patient outcomes. Internally in the department, having a prompt handover means that we are able to treat patients sooner rather than later, meet time-critical things like sepsis and stroke patients, and also for the wider community. If we are able to turn the crew around in the department in a more effective time manner, they can get out to the community to do the next 999 call, which is crucial.